Let's ask Jamie Jenkins, former head of health analysis at the Office for National Statistics. Hi, Jamie.
Hi, Gareth. You good?
I'm good, thanks. And I'm going to stress, hospitalisations and deaths are much, much lower than at comparable points in previous waves in the pandemic. We are, though, above the most likely scenario, and we are now on a par with England. How can that be?
Yeah, it's probably puzzling for a number of reasons, because I'll just probably quickly go through the numbers to try and kind of reassure the listeners in terms of what's going on. So the positivity rate, you said 17.7, and then with the data that we get from Public Health Wales, we can forward look the next couple of days, and I expect that to continue to go up. And normally, you talk that it's the highest since January, but what we've seen is you normally get these peaks and they start coming back down. So if we think back to last year, the positivity rate that we've seen at the moment is what we saw when we hit towards the end of October, and that's kind of when we started having that firebreak that the First Minister brought in last year. And cases per 100,000, because we're testing more people this year compared to last year, we didn't see the numbers that we're seeing now until early December last year. But I think there's a bit of a difference that's going on this year, Gareth, because last year, when we were seeing the case rates that we're seeing now, they were spread more evenly across the whole of the population. So we were seeing much more older people in amongst these kind of high case rates. But because we've allowed Wales to kind of open up and allow people to go about their kind of daily lives, and with the vaccine rollout as well, the majority of the people now, we are still seeing older people catching the virus. That's still in the data. But if you look at the proportion, it's far more younger people getting it. So that generally means that we're seeing far fewer people ending up in hospital and far fewer people dying from that. Now, Wales has been going up considerably over the last few weeks. Scotland's been going up as well. And we haven't seen the rates going up in England. And it may well be that England have had kind of higher infection rates generally throughout the kind of the pandemic, and it could well be that kind of the antibody levels and the like is just meaning that Wales is going up more than England at the moment.
What would you expect to happen? Because they've gone back to school in Scotland already. When Welsh schools start, what is it, just less than a fortnight now, isn't it?
Yeah, so in Scotland, if you track the rates in Scotland, and in particular the school-aged children, rates started going up in Scotland at the start of August. Now, most of the schools only went back last Wednesday in Scotland, and I've been tracking the data there. We haven't really seen things accelerate, but it's continued to go up. So it's still early days to see the full effect of the school opening. But remember, Gareth, it was last September when we saw things opening up with regards to schools going back across England and Wales, and we started seeing things go up. But in terms of what the numbers are with the vaccination rollout there, Gareth, we've got kind of 90% of people now, well over 90% of people have been vaccinated for months in the vulnerable groups. Even the 16 to 17-year-old age group, over half of them are vaccinated now. So if you actually track the number of cases we're seeing, we've got 80% reduction in hospitalisations and a 90% reduction in deaths, which is obviously significant. And Germany have announced this week that they're no longer going to be looking at case rates to kind of determine if they're going to have any interventions at all. And I suppose one of the benefits that Germany has, though, is that they've got a far better health system in terms of capacity. So in the UK, we've got 2.5 acute beds for every 1,000 people. In Germany, it's 8. And then if you look at ICU beds, which obviously where COVID patients may end up if they get seriously ill, they've got 4.5 times as many. So my big concern, I suppose, Gareth, is if you consider before the pandemic, we've seen stories of the NHS being in crisis most winters. So you add on top of that kind of COVID rates, and if they continue to kind of rise, I think it might be inevitable that there would be further kind of restrictions and pressure for restrictions, because the NHS struggles to cope in a normal year, let alone when there's a pandemic around.
And with that in mind, quickly if you can, do you think then there's an inevitability that the jab will be made available to 12 to 15-year-olds as well?
Well, that's what's coming out over the kind of the murmurs that are coming out in the press over the last 24 hours. How much of an impact that will have in regards to the overall hospitalisations and deaths, it's difficult to assess, because all the vulnerable people have had the vaccine, and younger people generally don't get ill. I think the rationale is that a vaccine does help slow the spread of the virus. It doesn't stop people catching the virus or passing on, but it does slow it down. So I think there's an inevitability when the press start picking up on these stories, you normally find, Gareth, that that's what happens next.
Good to speak to you, Jamie. It is the way, isn't it? Jamie Jenkins, former head of health analysis at the Office for National Statistics.